My warmest greetings to all the viewers. It gives me happiness to introduce Hemant Ji. He's a retired
Officer.
excise and taxation officer from the Haryana
Oh,
government. Um, he has been operated for a buccal mucosa cancer about 6 7 days back. He's had a wonderful post-operative period, and I thought that let's have a podcast so that it can be educative. How and did you come to know that you had it, and thereafter what all did we do, and what was your experience? Besides that, a little past, I think it's worth a mention that you had a history of the same buccal mucosa lesion operated upon in 2015 at Faridabad.
God, yes.
So at that time, it was considered rather early, or whatever be the reasons. When it's too early, the adjuvant treatments, adjuvant बोलते हैं, सर्जरी के बाद जो ट्रीटमेंट देते हैं उसको adjuvant बोलते हैं. So adjuvant in the form of radiation or chemo was not required. So it wasn't given. Well, so you might have some questions and we'll discuss them. At this time, when you came to me, you had an obvious cancer of the inner side of the cheek. We call it buccal mucosa. We did a biopsy, although without biopsy, also a
Clear.
clinician comes to know that this is a cancer. Rarely, even a biopsy can come negative. That doesn't matter. Then it'll, then we'll have to do another biopsy. We will not say that because the biopsy was negative, it's not cancer. It was obviously a large big ulcer which was growing in size. So it is a cancer. There wasn't any, we didn't have any differential diagnosis. So while we started preparing for the surgery, we waited for the biopsy. The biopsy came positive, and then we did your surgery about a week back. And you tell me what were your questions, and what is your experience? Or
My
Mannat wants to know anything. Batao.
my experience was very nice. I got very qualitatively treatment.
वंडरफुल जी, वेरी
Wonderful.
हैप्पी दैट आपको कोई दर्द नहीं हुआ
दर्द नहीं, हाँ जी.
पहले दिन से ही यू बिन अप एंड अबाउट
हाँ जी.
एंड वी कुड सेंड यू बैक इन होम इन 2 3 4 days time,
Yes, हाँ जी.
and you are taking oral fluids
Yes.
from yesterday or day before
Yes,
onwards.
हाँ जी.
So that's been like that. uh, उससे पहले कोई questions about cancer that you want to have which can be educative to listeners? Mannat has
Okay,
some.
yes, I have one question. Like before, like in 2015, he had mouth cancer. Then another one came after 9.5 years. What is the probability of the recurrence if, like, I would like to know
You see, we all know that smoking is a risk factor for oral cancer. Now, what does smoking do? It creates within the mouth, we call it upper aerodigestive tract, the whole of the mouth and the esophagus and the trachea and oropharynx, with different parts of the mouth. So all that mucosa genetic changes it brings about, and it makes you prone to develop cancers. It damages the entire mucosa and makes you prone to develop cancers. So when you're prone to develop cancer and you have developed cancer, so that means to say that your mucosa is prone to develop cancer now also, and it will continue to be prone to develop cancer even after 20 years.
even after he quits
Even
smoking?
after you commit. I used to be a smoker during my college days.
Yes.
Now it's been 40 years I have not smoked. But still, some bit of higher risk I still carry than a population which has never smoked. So smoking is bad, and these days we always say that either you're an illiterate, so you're smoking,
Hmm.
or else you're a fool if you're smoking.
Hmm.
सो या तो आपको लैक ऑफ नॉलेज है,
Hmm.
ठीक है, बट इफ यू नो दैट इट इज बैड एंड यू आर स्टिल स्मोकिंग,
Hmm.
इट्स फुलिश.
Foolishness.
So well, as he has left smoking now about 20 years back,
हाँ जी.
so the risk keeps reducing.
And what?
Every year it keeps reducing, but it never becomes zero.
Of
बट
course.
स्मोकिंग भी डॉक्टर साहब बहुत टाइम काफी साल
मैं
छोड़े
यही
हैं।
तो बता रहा हूँ
वो
कि
तो भी
कितने
रिस्क
साल
रहता है।
पहले भी आपने छोड़ दी हो, फिर भी आपका रिस्क उतना नहीं होता जितना कि आपको है.
And alcohol as well.
Alcohol makes it multiplicative, exponential. If you're a smoker, then there are 10 times, let's say, risk than average population. And if you are a drinker also, then it is 10 into 10, 100 times. So smoking and drinking, they compound as a risk factor. So things which are bad, we only try and find justifications that everybody smokes, then why can't I? Everybody drinks, then why can't I? So they are justifications. It has been proven that smoking and drinking both are 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 not healthy. Smoking and drinking are not healthy habits. It is universally proven. There's no doubt about it. Tell me anything else.
Another question, like he could feel there is something inside his mouth. Suppose I cannot feel there is something. So are there in the studies or in the research papers, are there any other symptoms ki mouth cancer ka?
Mouth
Maybe lose
cancer
loss of weight or
is
something.
the safest thing to have. Why? Because the stomach cancer you can't see. Ovarian cancer you can't see. This is an area which one can see in the mirror, which can feel with the finger yourself.
Yes.
So if you're feeling a wound in the mouth which is not healed in 3 weeks' time, it should be shown to a cancer specialist and not to anyone else, because nobody else will be able to diagnose it. I mean, you say I went to a gynecologist, they would not be able to. I've just given an example, far fetched, but you can't just go to anyone and say मैं तो डॉक्टर को दिखाया था. Because there are people who come to us कि मैम 6 महीने से डॉक्टर्स को दिखा रहे हैं, बायोप्सी भी ली जा चुकी है, तो और सब कुछ नेगेटिव है, मगर ये अल्सर ठीक नहीं हो रहा. When you come to a cancer surgeon or cancer specialist, cancer surgeon essentially, because surgeon does clinical examinations. The physician doesn't do it. The surgeon does clinical examinations. The physician will give chemotherapy when it's required. So oral cancer will be diagnosed by a cancer surgeon by just clinical look. Clinically, by just looking at it, he'll say it's a cancer. Let the biopsy be anything. Okay?
What are the measures to be adopted for taking care of teeth? Just like scaling or
Scaling, if there is any doubts about should we get scaling or not, we should get it done. Scaling improves the health of the teeth. There is no doubt about it. So timely scaling, once in year or two, whatever the dentists recommend, should be adhered to, because we are unable to always keep all the teeth clean, interdental as well as the plaques which form. So the dentists do a very good job of giving you healthy teeth. So you should get it done.
okay.
Regarding the teeth, we were actually discussing at home that there's a term that you use that we are doing the commando surgery.
Oh.
What do we mean to a layman?
I think
What
a
is
commando surgery in last podcast I did explain. A commando word has been used from the army. When we want to do a devastating operation on an enemy, we call it a commando operation in the army language. So here also it's a devastating operation on the face, because the jaw is removed, all the lymph nodes are removed, muscles are removed, glands are removed, and this is all devastation. But thereafter we put you back in shape, and that devastation has been looked after now. So from the day one you've been feeling normal. Nobody can say your face is looking normal, your functions are normal, you can speak normally. So that word has been taken from the army parlance. Okay.
So it's necessary that the teeth will be removed.
Oh,
Yeah.
So not all cancers of the mouth, the teeth will be removed or the jaw will be removed. I mean, one of the last podcasts we had to remove the entire jaw. Or sometimes we may have to remove the entire jaw completely. In his case, like yesterday I recorded a podcast on the second day post-op. His jaw was half jaw was removed, and he was absolutely normal. He was sitting with us on the second day post-op. So not every in your case, Hemantji, we've not removed the jaw, but we've removed the teeth. We call it a marginal mandiblectomy. The upper, border of the jaw has been removed. The chin and the this lower border, the body has been saved, but we have removed the upper border. Why? Because the buccal mucosa, your tumor had gone into the teeth,
Okay.
so we removed the upper border, and we preserved your jaw.
Okay.
And then we took a muscle from and skin from the thigh, and by a microvascular reconstruction, anastomosis, we put that skin in your mouth so that the entire cheek from inside has been made, and your jaw also, which was exposed, now the bone has also been covered. So, do these things have to be done always? No. In a tongue cancer, we don't have to remove the jaw unless the tongue has involved the jaw.
Right.
So, if a jaw cancer is there, then we have to remove that part of the jaw. In his case, it was neither a tongue cancer nor a jaw cancer. It was a cancer of the inner lining of the cheek,
Right.
buccal mucosa, which has gone into the teeth, not into the jaw as such. So, we removed the upper part of the jaw. So, it all depends upon the various types of oral cancer. So you leave it to us then to take a decision what is best for you. Now, what is cancer surgery? Cancer surgery is all about the removing the entire thing wide locally. Now, what is wide local? Wide local means go 1 centimeter beyond the tumor on all the sides, 5 sides. That means left, right, anterior, posterior, and depth. Three-dimensionally, we remove it with 1 centimeter margins. That's what is cancer surgery. And along with that, remove all the possible roots of that cancer which are in the neck. So the entire neck nodes have been cleared. So he doesn't have neck nodes now.
Yeah.
Now, do you think that it is going to be of any harm or danger to
Yeah.
him? Not at all. Not at all. And in this case, and we always do that, we have sent it to the pathologist on table, and we have proved them also that they were positive on the left side, and they were but not positive on the right side. We had to do a comprehensive neck dissection on both the sides, left side also, right side also. So, but one cannot really make out.
Yeah.
Hardly any scars are visible. So yeah, this is, after all, thanks to the gadgetry available, thanks to the number of years of experience. Okay. So, और बताइए.
बस बहुत अच्छा.
Any question?
So this is the second time relapse. Again, another. We know it's all uncertain.
Don't think like that.
Yeah.
I would request you, don't
Right.
be ever pessimistic,
Right.
because if you think of recurrences happen.
Right.
Just forget about it and lead a healthy, happy life.
Right.
Healthy, happy life, free of alcohol, free of smoking.
Best
Go to
one.
bed early, get up early, do your yogasans, do your meditations, live cheerfully, happily, be happy and spread happiness. That will keep you healthy.
बहुत अच्छा.